Hey, how's it going? Okay. So should we shake hands or not?
Well, I guess technically we're supposed to stop. It's really hard to do.
It's a hard habit to break.
Yeah, it really is. It really is. I guess.
Centuries old hard habit to break. What's the replacement? Is elbow bumps okay? Can we do this?
Yes, actually, I really like that one. It's kind of going around. Some people are doing this.
Liz?
Yeah, somebody can fall down.
We want to have a picture with the
sign.
My big old fingers will be right, Noemi. How's that look? We're just gonna fist bump from here on out. Good seeing you. Air
Good
fist bump.
morning. As the sheriff is fist bumping around the room, we're gonna get started. So my name is Tammy Moss-Chandler. I'm the Director of Health and Human Services, and thank you very much for coming today. We have seats in the front for those people who are scheduled speakers and for any media that need the seats. Thank you for those of you who are in the audience for standing. We actually today, after all the speakers say a few words, we will have questions for media only. So if you're here and you're not with a media representative, if you're not a representative with the media, we actually do have cards, so we can also still follow up and get your questions answered. So there's cards on the table inside and outside the room. And we have county employees there to help you to make sure that we collect those from you. And we promise that we will get back to you through the call center that we've set up specifically to address novel coronavirus in Mendocino County. And that website is posted here on the board today to make sure that we get a lot of attention on where to call locally for the latest, most current, accurate information. And we have our call center open right now, 8 to 5, every day, Monday through Friday. We certainly are ready to open it for more hours if our community needs that. But right now you can call and get a live person during the day. You can leave a message after hours and get followed up the next business day. And certainly we're monitoring that for, again, for any urgent or especially time-sensitive responses. So before we get started with Dr. Doohan's presentation today, I'd like to invite up Carmel Angelo, who in addition to being the County Executive Office for Mendocino County is our Office of Emergency Services Director.
Thank you, Tammy. Good morning, everyone. Thank you so much for joining us. I particularly want to thank our community partners who are here, the schools, the hospitals, and also our public safety partners, their sheriff's office. Yesterday, Mendocino County declared a local emergency, and we also declared a public health emergency. And those declarations were sent up to the state Cal OES. And so today we're doing this press conference in hopes that we could give the public and through the media as much information as possible, and certainly the information that we have. At this time, it is my pleasure to introduce Sheriff Matt Kendall. And what I certainly would like everyone to know is that public safety, public health, the executive office, we work closely together, and particularly when there are events where we need to respond quickly and fully to the public. So you'll be hearing more about COVID-19 today from our health officer, but at this point in time, it's my pleasure to introduce Sheriff Matt Kendall.
Good morning, Sheriff Matt Kendall. So today I'm speaking with you not just as a sheriff of Mendocino County, however, also as a first responder. The sheriff's office, my office is also responsible for running the jail. And so we have a lot of things to discuss here real quick. I'm gonna try to keep it short and sweet because honestly, Dr. Doohan is the expert on this. I'm responsible for the well-being of not only the inmates in the jail, the people who are housed there, but also the staff that's working there, and also responsible to assist in getting the best, most transparent information out to the public that we can. We don't want to vacuum the information when people are concerned. We want to be able to fill that vacuum so that we don't have problems. The Sheriff's Office, working with our CEO, Carmel Angelo, and the Office of Emergency Services, is here to support Dr. Doohan and public health. We put a lot of best practices to work in our jail right now to make sure that the people who are housed there, as well as our personnel that are working there, are taken care of. Also with the first responders on the street. You won't see deputies reaching out to shake hands for a little while. As our little meme over there says, a fist bump, it's safer than a handshake and cooler than a wave. And it's just that this is one of those times where we don't want deputies shaking a lot of hands. We've spoken with several of the California State Sheriffs through the California State Sheriffs Association. All the state sheriffs are working with their public health officials also. We're all coming together and working very hard on this. The procedures that we put in place, I believe are going to keep our personnel safe, keep the public safe, and help us to get a little further down the road. And I just want to remind everybody that epidemics have been occurring in the United States since the dawn of time. And I mean, they've been occurring in jails since we first instituted jails. We've dealt with tuberculosis, chicken pox. We've dealt with all different types of things that come out. A little feedback there. And we've done a very good job at it. We have some cells that are direct ventilation, things like that, so that we don't infect the rest of the population if we did have one of these cases come in. So I just wanted to reassure everyone that we are working with public health and with the public health officer, the county's health officer, and Mendocino County is ready for this. Thank you.
Thank you, Sheriff Kendall. Dr. Doohan has been the Mendocino County Health Officer since the summer of 2019. She's actually worked with us very closely with our former state health officer, Dr. Karen Smith, who actually has been helping us look at our public health system in Mendocino County to be ready for just a time such as this. Dr. Doohan is well educated. She's a Stanford graduate. She has a PhD background in biology. She has her studies in public health. And she actually is a very valued clinician for us locally, and she's been an amazing leader in public health for us here as we've gone into monitoring and getting ready for this kind of communicable disease outbreak. So Dr. Doohan, thank you for sharing with us today the latest.
Can you hear me? Yes. There's some feedback. Is that better? Yes. Hello? Not better. Good morning, everybody. I love Mendocino County like we all do. And my goal here today, our goal, is to reassure our community, our county, and to educate our community and county about what we have before us with COVID-19, the novel coronavirus. Yesterday, as was mentioned by Carmel Angelo, there was a declaration of a local and public health emergency for our county. This is following the declaration of local and public health emergencies by counties in our region across California, and also yesterday by Gavin Newsom for the state of California. You may have heard the word pandemic being suggested, and I want to reassure us, but also caution us about what this word means. We are not in a pandemic at this time, but you've probably been hearing in the media that we may be approaching a pandemic. A pandemic is when a communicable disease is around the world, and it is affecting people around the world and spreading in the community. And that doesn't necessarily mean that it's a more deadly disease than any other diseases we have. We can think of this similar to influenza, a severe influenza. But it is, because it is a new infection to our planet, because it came from animals in Wuhan, China, in the end of December, we don't have immunity to it in our population. So the concern is it will spread in our population and affect many people simultaneously. So that is the primary concern that we have at this time with coronavirus, the novel coronavirus, is we want to control the spread. We want to slow it down. And so what I'm going to be talking to you about today in my presentation is the approach that we can take as a community to slow and control the spread of this coronavirus. So as I was introduced, I'm your public health officer. I'm here to serve you. And as a public health officer, my role is in emergencies and in disaster preparedness, in communicable diseases, and is also to educate the public. I'm representing the public here before you, and I'm here to answer questions. I really appreciate how engaged our community is. And I know through Facebook and other social media that there have been questions about what we're doing in the county to respond. And so I'm grateful for those questions from the public, and I'm grateful to have the opportunity to respond to those questions. And as was mentioned, we have a call center, and we have different resources where people can get information. We'll be having every Monday a press release so that we can keep you up to date. This is a rapidly evolving situation. We have been working 24/7 since early January to respond to the COVID-19 situation. And I can tell you that I've written several press releases now where by the end of the day, it's different. And we've had some criticism where people have said, well, you said there was this going on and now it's this. Well, that's because it's rapidly evolving. And we are on top of it. We are staying 24/7 on top of this situation. Some people have asked who I am and where I come from. I am a Mendocino County person. I've been here for 5 years. I've worked for Adventist Health for 5 years. I know the healthcare system in this community. I know our capacities. I'm a family physician. I've worked in hospital and in clinic. And now as a health officer, I have the privilege of serving in this capacity. So what the recommendations I'm going to be giving today are based on my knowledge of our county and our healthcare capacities as a healthcare system, and as well as with our public health department. The work we've been doing with this COVID-19 situation has included tracking all of the returning travelers from mainland China and from the high-profile cruises you may have heard of. When we are aware of these individuals coming into our county, we reach out to them. If indicated, they are on home quarantine, and we have public health monitoring of them daily. You may have seen in the New York Times an article about 2 passengers on the Westerdam cruise ship who returned, and there was a possible case on that ship. Turned out that there was not actually a COVID-19 case on that ship, but we initially thought there was. These individuals were on home quarantine. We called them daily, and they had no symptoms whatsoever, and then were not needed to be tested because they didn't have symptoms, and it actually did not turn out to be that they had an exposure. We've had other return travelers from mainland China that were on home quarantine. They never were sick, and they never were indicated to be tested for COVID-19. For this reason, we have not had any cases of COVID-19 in our county. We've been tracking people, we've been monitoring them, but we have not had any people with the criteria of exposures to COVID-19 as well as being sick. So we've not had any cases. We're very fortunate. But we have declared a health emergency because even though we don't have any cases, we are surrounded by counties that do, and we know the community spread is occurring. So we are preparing. It's really important for everyone to understand the nature of the testing for COVID-19. It is controlled by the CDC, a federal agency. There is no FDA-approved test available commercially. Therefore, if you go to the hospital or a clinic and you ask your doctor to be tested, they do not at this time have a test that they control in the hospital or clinic. It comes from the CDC. We are hoping and waiting, and there is the assurance that there will be a commercially available test in the future, and at that time, testing for COVID-19 will become much more available to our community. At this time, the process, and I want to share this because this is one of the most important questions we're being asked now. The process is that the CDC controls the tests and they distribute them to the state public health labs. Gavin Newsom announced yesterday that 5,000 test kits were distributed to California. But still, those tests are only at public health labs. And we do not have a public health lab in Mendocino County. Our closest is Sonoma County, and the test is actually in the Richmond lab. So if we were to do a test I would be in contact with the CDC, I would approve the testing, and then it would have to be transported to a public health lab, and this takes time. So there have been some rumors that we can get a result in 6 hours. No, it's going to take days because we have to transfer the samples in a very specific way to the public health lab, and we do not have one closer than Richmond at this time. But we are very hopeful that we will have a commercially available test in the future, and that will make it much more readily available for our community. Yesterday, Gavin Newsom declared a state of emergency for the state of California, and he also encouraged in this press conference citizens with respiratory illness to seek out testing from public health departments or from their clinicians. But as I said, there were only 5,000 test kits sent to California. And we all know, if you've been following the news, that there is a new cruise ship that we're concerned about. And this cruise ship is the one that went from San Francisco to Mexico and is now, I do not believe as of this morning, was allowed to dock back in San Francisco. We have 2,500 passengers on that cruise ship, with people who have left the cruise ship and have been identified as having COVID-19. In fact, there was a death from one of those passengers in the Bay Area in the last several days. So the priority for these 5,000 test kits is going to be focused on making sure that people at the highest risk of having COVID-19 are tested. And then, of course, anybody who has COVID-19, think about all the healthcare workers that were accessing that person before we knew they had COVID-19. So we need to be sure our healthcare workers are safe, our first responders are safe, our law enforcement is safe. So the COVID-19 tests at this time need to be used in a priority for those who are at the highest risk. I also want to share that the testing for COVID-19 has very strict criteria. So up until last week, we could only test people who had been coming from mainland China, who had an exposure to someone with COVID-19 and was ill with respiratory symptoms and fever. At the end of last week, the CDC made new guidelines whereby we could test people that were hospitalized with severe respiratory illness, serious respiratory illness, with no other explanation for why they were sick. And that is why, at the end of last week, we had some testing that was done to people that we didn't think had exposure, and then we found out they were positive, including the person from this cruise ship that I mentioned, who was in a Sonoma hospital. They got that case in Sonoma last week. So we are seeing community spread because now we're able to test more people, but again, it's the CDC who mandates who we can test. Yesterday, it was announced by the CDC that we can test, the new criteria for the test they control, the COVID-19 test, we can test anybody with respiratory symptoms. You can imagine the impact that would put on our public health department, our healthcare providers, if we only have 5,000 tests in the state of California, test kits, and we are now being asked by people that are not high risk exposures, who aren't very sick. It's a very challenging situation for us. And as the health officer, knowing our healthcare system in Mendocino County, with my experiences of having practiced medicine in this community, and as my experience as a public health officer, it is my decision that we will be prioritizing who we test in Mendocino County to people that are with an exposure that is high risk, such as these travelers coming back on this cruise ship from Mexico to San Francisco. Some of them are going to be coming into the community, such as people that have had a contact with COVID-19 case, or people that are hospitalized who have serious respiratory illness, that we want to be sure, we want to test them for COVID-19. So at this time, we are prioritizing who will be receiving the test. Any cases that are being considered come through to the health officer, and there's a system we have in place called RedCom with our EMS system, where I am alerted rapidly, and then I can consult with the doctor and then or whoever the provider is in the CDC. So given our constrained resources of the test kits not being in high enough number for our state, and for the distance where our public health lab is in Richmond, California, and the fact we don't have any cases in our county at this time, we're going to have to be careful, though, to make sure we do not have spread in our county, and we will be monitoring closely. Some good news about COVID-19. There is good news. 80% of people have mild symptoms. 80%. Children don't seem to be affected in a serious way. It's like, for people who get it, for most people, it's like a serious flu. It has a similar contagiousness to flu. So there are viruses that are more contagious, like measles. This is about the same as flu. It has a 14-day incubation. So that's when you might hear about people being in isolation, or quarantine at home for 14 days. It's spread by droplets, so that can be protected if a person is sick by them wearing a surgical mask. It's easy to kill with disinfectant and soap. And while there is not an antiviral treatment at this time, and there's not a vaccine at this time, these are being worked on around the world to be developed, and we know that we can give supportive care to people, and people get better. Most people get better like they do from the flu. So until the FDA approves a commercially available test, and that test will be available in clinics and hospitals, we are going to be cautiously proceeding with the new guidance that anybody with respiratory symptoms can get COVID-19 testing. One thing that we're able to do is we can have people that have been exposed, we can have them on home quarantine with active monitoring with public health. We've been doing that for the last 6 weeks for the people returned from mainland China. We've had nobody become sick that's been on home quarantine. This is a very good way for us to make sure that disease doesn't spread. So now is the time to practice caution to mitigate the spread of COVID-19. What we need to do is stay home if we're sick. So many of us go to work sick because we're stoic, we want to just keep going. Maybe we need to keep going because of our need to work, but we need to at this point shift to staying home if we have a fever and respiratory illness, if that is a mild condition. If you are sick enough to need medical care, call ahead, please, if you can. If you call 911, let them have a heads up that you have fever and respiratory illness. If you're going to go into your clinic, call ahead, please, if you can. And then again, please, start a new practice. No more handshaking for a while. Fist bump, elbow bump. Just let people know that we're protecting each other by not shaking hands, not hugging until we get through COVID-19, which we will. We'll get through this. Avoid crowds if you don't need to go. Stay 6 feet away from people if you don't need to be close. Make plans with your work and school to stay home if you need to, so that you can have distance work if possible, or if your child gets sick, they can have homework sent home. And as for any disaster preparedness, which we know we should be prepared for disasters, make sure that you have some non-perishable food in your home. Get to know your neighbors so that you can have support from one another. Make sure that you have a supply of medicine, a month's supply at home. These are the same guidances we would give to prepare for any disaster, which we all should do all the time. And also, please let's have particular care about our healthcare workers and our first responders. We need them to stay healthy. So if we do have fever or respiratory illness, we really must call ahead and let our healthcare workers know so they can protect themselves by wearing the proper protective equipment, like mask, gown, gloves, and so on, so that when we come into the healthcare facility, they are protected from getting sick. So it's my honor to serve you as your health officer, and I hope that this presentation has given the information that will help you have confidence and reassurance that we are all working so very hard for the health of our community. Thank you.
Thank you, Dr. Doohan. I'm sure there are questions for Dr. Doohan, and we are going to actually hold questions. We have just a couple of more speakers, and then we'll take questions from the media. So one of the questions that's often asked is, what is the public health officer's role with our healthcare delivery system? And in Mendocino County, like every county across California, our health officer works in coordination with our local EMS agency, which is Coastal Valley's EMS agency. And together they lead hospital preparedness and public health preparedness with our communicable disease control team within public health. So we've invited Jason Wells, who is the CEO of Adventist Health, to come and share a little bit with you and some of his leadership team members about what the hospital is doing in partnership with public health as we're ready and prepared to respond to coronavirus in our community.
Good morning. We have appreciated the partnership with Public Health. Dr. Doohan's leadership has been exceptional, and she's been a tremendous resource. Thank you to help us in the hospital work and the clinic work to make sure we are absolutely prepared. Our hospitals and clinics deal with infectious disease each and every day. Very well trained, and keeping our staff safe and our patients safe is our top priority. We have worked closely with Mendocino County District Hospital, and Wayne Allen, the CEO there, and Dr. William Miller, the Chief Medical Officer, to coordinate care with all 3 hospitals across the county to make sure that our patients are safe and again, staff well cared for. Today with me, I have Dr. Basant Parker, our Chief Medical Officer, Linda Givens, Chief Medical Officer at Howard Memorial, and Lindsay Spencer, Chief Nursing Officer at Adventist Health Ukiah Valley. And Lindsay and Basant will come share some of the preparedness and what we've been doing at Adventist Health to be ready for this. Thank you.
Good morning. We at Adventist Health in Mendocino County are prepared, as our CEO just said. We deal with infectious disease all the time, and so we have isolation rooms, we have physicians who know what to do, we have nurses and other providers who are well trained to take care of patients. I'll go through a few specifics of what we have, just to reassure you and to also inform you about what we're able to do for you. So, number one, we triage for patients for symptoms and travel history when they come to our hospitals and our clinics. We also have educated our providers and staff in this season of COVID-19. We've educated them about the disease. We have also educated them about the appropriate gear to wear to take care of patients. We've had huddles, we've had drills, we've had demonstration, we've had meetings, and we do have for all our staff a health stream module that everyone needs to take just to be abreast with what is current. We have daily updates to our staff and providers, and this is all based on CDC information and information that we get from the Cali Department of Public Health. We have increased cleaning frequency in our waiting areas. We also have masks, alcohol, hand sanitizers, signs at our entrances to the clinics, ED, and hospital. We are working with Adventist Health System. We are part of a bigger system. That is a big advantage to us. And so we're working with them, we're working with state and local public health supply chains to assure that we continue to have adequate supplies for you when you need care. Staff in high exposure areas have been fit tested for the N95 masks, and PPE is also made available to them. We encourage patients with fever and respiratory symptoms to call the clinics before coming so the staff can meet them at the entrance and give them a mask, just to protect everyone, patients, staff, just so we can continue to take care of you. We're a small community. We would like to protect as many staff as possible just so we can continue to care for you. So with that, I'll pass it on to Lindsay to give you some details about what we will do if a patient were to come to us.
Good morning, everyone. I'm going to spend a little time talking about if we had a confirmed COVID-19 patient who required hospitalization. So as with any patient, staff and patient safety is our top priority. The care would depend on how severe the patient's symptoms were. We would limit exposure to staff by truly limiting who is caring for the patient. So making sure that we are grouping care and not having numerous people go into the room with the patient. We do have airborne isolation rooms, both in the emergency departments and the inpatient units. We would keep logs of all healthcare providers and visitors of who's going in. Of course, we would want to very much limit visitors as much as possible. As Dr. Parker said, we have the appropriate personal protective equipment, and our staff are trained on that. If we were to experience a surge, we would utilize our disaster plan. And unfortunately, in the last several years, we've had to utilize this related to our power outages, the fires. So this is something, again, we're unfortunately very versed in doing. Keeping staff well, as Dr. Doohan said, is very important. So we are encouraging and supporting staff, if they are sick, to stay home. Again, we would limit the amount of staff as much as possible who came in contact with a positive case. We can create capacity if needed by canceling elective cases or visits. We're not there yet, but we would do that to increase our staff capacity. And we could utilize staff from our Adventist Health System and other hospitals, as well as agency staff.
And from out of state as well. Thank you.
Thank you very much. At this time, I'd like to invite up Michelle Hutchins, who's our Mendocino County Office of Education Superintendent of Schools. In addition to Dr. Doohan's work locally with our healthcare community through our public health department and with California Department of Health and the CDC on a daily basis, we also have been working with the schools and their leadership to give good guidance to their educators and their families. And I'm very proud to be partnering with NCOE and your leadership in providing more virtual training for our educators. And thank you for being with us today.
Thank you. Again, we are working very closely with public health and are very appreciative of their guidance as we're working through this pandemic. I want to mention that all of our schools have board-approved safety plans that address both illness and pandemic situations. Our goal is doing everything we can to keep kids safe. A specific example that I can give is with Ukiah Unified. They currently have approved overtime for all of their custodians so they can double the cleaning they're doing in the classrooms. We're making sure to clean all touch points in our schools just to ensure kids stay safe. We want to recognize it is extremely beneficial for the kids and our community if healthy kids can stay in school. We are also working on solutions for any child who has to stay at home so that they can continue to gain credits if they're a secondary student or continue their education as an elementary student. So again, we want to thank Public Health for their guidance, and we are working very closely with them so that we are guiding our school leaders to guide their staffs. So thank you.
Thank you. And finally, we'd like to invite up our local congressional assembly member and senator's office for representing Mendocino County. We're grateful in this time when a public health issue is becoming a political debate issue that we've had daily coordination and communication with our elected offices at the state and federal level to make sure that they have accurate and clear information about what's happening with public health locally. So at this time, I'd like to invite up our local representatives, and if you would each introduce yourself and share, I'd appreciate it. And we'll have Sheba Brown come up first. Thank you.
Hi, my name is Sheba Brown, and I am the Mendocino County Field Representative for Congressman Jared Huffman, and I have a statement from the Congressman. Thanks very much for this opportunity to join you through this statement. Thanks to the County of Mendocino and Health and Human Services for this press conference and for your enduring readiness to protect public safety. I want you to know that I am here as your federal representative in Congress to have your back in what looks to be just the beginning of a public health emergency. California has now lost a life to the coronavirus. As this epidemic continues to spread, it's important for you to know that the federal government is here to support your efforts to keep the public safe and informed. Yesterday, the House of Representatives, with strong bipartisan support, approved robust legislation to provide $8.3 billion through an emergency supplemental appropriations bill to fully address the coronavirus and protect Americans from the growing public health crisis. I expect the Senate and President Trump to follow suit and support this fully funded, science-based supplemental funding bill quickly. I believe Americans deserve a coordinated, comprehensive, whole-of-government response to prepare for the spread of coronavirus. Our collective first priority must be public safety, and we must govern responsibly to meet our challenges facing our nation and its public health. I want you to know that my office will continue to stay in close contact with the local, state, and federal stakeholders to assess our preparedness and ensure that California has all the resources necessary to meet this challenge head-on. As always, my office is here to assist you with any questions, concerns, or issues you may be facing with federal agencies, and we will continue to share information with you as it becomes available. Thank you.
Good morning. My name is Taylor Morrison. I'm a district representative for State Senator Mike McGuire. I'm grateful to be here today with you all today. Senator McGuire regrets that he couldn't be here this morning, but he wanted to provide you an update on the latest response to COVID-19 here in California. At this point, the risk to the general public remains low. California has received additional virus test kits from the Federal Centers of Disease Control, allowing the state to test thousands of new people. That said, more have been requested with the anticipated need. The state has received permission, and we have opened up 14 public health laboratories for virus testing. The labs are providing testing within a 48-hour turnaround time. More public health labs will soon be able to test, ramping up to a total of 20 public health labs in California in the coming weeks. Staff from the Federal Centers for Disease Control continue to be embedded here in California, working in partnership with the California Department of Public Health on managing suspected and confirmed virus cases and tracking patients and those they have had contact with. The state will be investing a minimum of $20 million into response efforts, which will allow operations to continue to expand. We have opened our State Operations Center, California's emergency operations hub, and all virus response efforts are being run through a unified command out of the center. Again, at this point, the threat to the general public remains low here in California. Thank you again for being here, and thank you to the County of Mendocino, Congressman Huffman and Assembly Member Wood for your partnership. Thank you.
My name is Ruth Valenzuela. I'm the District Director for Assemblymember Jim Wood. I have a statement for me. I'm very aware that everyone is concerned about the new coronavirus, now known as COVID-19. And even more so, people want to be assured that the information they're receiving is accurate and scientifically sound, and that the level of risk to our health is clearly stated to avoid unnecessary alarm. As a healthcare provider, I want to make sure that everyone has scientifically based and correct information. I have an open line of communication with our state's Department of Public Health and will ensure that any new or revised information gets out to the people you depend on for information. The Mendocino County Public Health officials and staff are dedicated community members who will make sure that you receive the most up-to-date and factual information. Every year we experience the common flu, and for some it can be fatal. So it is my hope that with regard to COVID-19, we proceed calmly and with all the best knowledge and information so that we can do everything we can to protect ourselves and our families and know where to go to get the very latest and dependable information. The experts remind us that how to protect ourselves from COVID-19 is the same as how we protect ourselves from the common flu. Our California Department of Public Health Department works for you, and they are there to provide the best information on COVID-19. And our public health departments, whether at the state, county, or city level, are there for you as well. No elected official, including those of us who are healthcare providers, should be the ultimate source of information. We must rely on and trust our public health officials to keep us informed and prepared. It's their job and responsibility, and information changes by the day and sometimes by the hour. Governor Newsom is taking a very aggressive approach, along with Mark Alley, our Secretary of Health and Human Services, and are making sure we have the resources we need And just yesterday, the governor declared an emergency proclamation to assure that California can address any spread of COVID-19. He specifically mentioned in his comments that he has a commitment to rural communities and is making sure that we will have what we need. We should all be working together as one, whether you are a member of the media, a local public official, a health official, a state or federal official, or a neighbor, just to make sure that the information you're receiving and giving is accurate and appropriate. Thank you.
Thank you for those thoughtful statements. At this time, we're going to invite Dr. Doohan up and we'll open for questions and answers from the media. I would ask that you introduce yourself and the media outlet that you represent so we can follow up with you if needed afterwards.
My name is Jacqueline Orozco and I am from Malpunto, the Spanish newspaper. And my question is, you have the call center. Are you going to have a bilingual staff?
Thank you for that question. We actually have the call center staff staffed every shift with a bilingual individual in Spanish-speaking language, and we have access for other language assistance as well, but a live person is in there in every shift who speaks Spanish as well. Other questions?
Should I use the mic?
Yes.
Thanks. Adrian Bauman with Mendocino Voice. I'm wondering if you can give us the numbers for mortality and transmission rate, and if you can tell us a little bit more about the percentage of people who actually become severely ill.
So as this is a rapidly evolving epidemic, and the data is still being determined, we don't have those numbers at this time because, for example, there are many people who are infected but don't become sick, and that we call that the denominator, the number of people that we call them asymptomatic. So unless we know how many people are infected but don't get sick, we can't determine the ratio of fatality rate. But the WHO is publishing their findings regarding that and updating their website, so that's a good source of information.
Yeah, I got a few more. Do you know the name of the ship that's currently?
I think it's the Grand Princess. Can
Okay.
anybody verify that? It's a San Francisco to Mexico cruise line.
What are the county's specific quarantine powers if you do decide to exercise that?
So if somebody is mandated to be quarantined, I do have the authority to declare them to be required to be at home for 14 days.
Okay.
And we have not had to, everybody who has been on quarantine at this time has voluntarily complied and been absolutely cooperative, so that has not needed to be used at all.
But that would be, you have the power to mandate people stay at home, not in a different location.
Correct. So you're probably thinking about the federal repatriation of people from Wuhan, China, as well as from the Diamond Princess cruise ship. Those people were under federal repatriation. That is separate from when we have someone, a returning traveler, coming back to Mendocino County who maybe was from, for example, mainland China, that we asked to stay home for 14 days. And all of those people remained asymptomatic during their period of home quarantine.
Okay.
Other questions down here?
I'm Kate Maxwell, also with Mendocino Voice. So, do you have any numbers about whether or not any Mendocino County resident has received a test beyond the 2 Westerdian, or were the Westerdian passengers
Thank
tested
you for
as
asking.
everyone else, and the number of how many people that have been self-quarantined here?
So thank you for that question. There has been confusion about, first of all, the word quarantine and isolation. So quarantine is when somebody is not sick, and with caution, we're asking them to stay home. They have no symptoms, and they have no indication of being ill. So we have followed the CDC guidelines about who to test that were in place up until Friday, which was somebody who was returning from a high-risk international travel, which would be mainland China, Iran, Italy, South Korea. If any of these people returned to our county or had COVID-19 exposure, and were sick with respiratory symptoms and fever, they would have been tested. We had nobody that we were aware of in this category. And we can only be aware of those people that the State Department inform us that have returned, and those only were being tracked from mainland China. We have had some people who have identified themselves through their healthcare workers as being returning from, I think we had someone from Italy, and we asked them voluntarily to stay home. Everyone has been cooperative and have wanted to stay home for 14 days to protect their neighbors and to protect the community. So we have not tested anyone for COVID-19 up to this time because nobody has met the criteria, but these criteria have changed, as I mentioned. So I'm certain that we will have some COVID-19 testing in this community. It's going to be focused on those people that are high risk or that have a respiratory illness that is unexplained, that is hospitalized, and that is essentially the criteria that was up until Friday.
So just to follow up, I know there was at least 2 people self-monitoring at home. Do you have a total number so far that have been self-monitoring? And then also to follow up on the translation, will the weekly updates and any potential urgency updates be translated at all?
So I'll have Tammy answer the second question. So there'll be a weekly press release on Mondays. We just put out one yesterday, 2 days ago. Monday, it's a blur.
And in terms of translation into Spanish, there will be materials translated into Spanish. It's being updated as we speak as well around more and more materials. And we look forward to working with our Spanish-speaking community. We have a really strong network through our community outreach unit already in terms of our Spanish-speaking community and what resources would be most helpful to translate most quickly.
And then to answer your question, yes. And there was a press release yesterday, thank you, regarding our emergency declaration. So there's a system whereby our public health department is alerted to people that are returning from Wuhan, China. And that information comes to me. There have been a number of the people we were alerted about that when we called them, it was greater than 14 days since they had been in mainland China. So I can't remember the exact number of people that we were alerted to that actually were not within that 14-day window, but I would say it was about 7 people that we contacted, and in fact, they had been in mainland China 20 days before and they didn't need to be quarantined. The 2 from the Westerdam cruise ship, that was voluntary because it was a question about whether the person on the ship actually had COVID-19. There was one person who was tested positive. This was in the news. There was a New York Times story about it. They tested positive, but then they were removed from the ship and they retested them twice, negative tests. But those return travelers that gave an interview to the New York Times, we asked them to voluntarily quarantine, which they were very cooperative and they did. And then when it became clear that the traveler, the COVID-19 positive case was not a true positive, they were no longer quarantined. We have, I believe it was 2 others that came back from mainland China within a 14-day period, remained symptomatic throughout, and were released from quarantine. So it's been a small number, under 5. That have been on home quarantine, and none of them have been sick. If any of them had become sick, they would have been tested, but they did not, thankfully.
One more question about that. The people who are there, you mentioned briefly that there might be people on the cruise ship that's currently having a problem who might be from Mendocino County. Will you be monitoring those people as they come up?
We have not been, unlike the return travelers from mainland China, which we were informed about, we are not informed about where the people from that cruise ship have gone, okay? And we would be ready to receive that information from the state or federal government if we were to receive it, or if we receive it from the individuals themselves, we would want them, if they would like to let us know that they've come back to our county or their healthcare providers, we would like to know that they're here in our county. But it's not like the mainland China returning travelers. That was from the government to us, and we are not, they're not tracking those travelers in that way.
So I had a few questions for the hospitals. How many beds will be available if this becomes sort of an epidemic with lots and lots of people sick? How many people will be available? How many beds will be available across the county? And it was mentioned that the hospitals have isolation rooms, but I wasn't clear on which hospitals, or if that's all the hospitals or how many isolation rooms are in each hospital. And lastly, if we do have a situation where all the beds begin to fill up, what happens? How do you triage people coming down with these cases versus ordinary hospital traffic?
So first, I'd like to say that part of our public health emergency preparedness and hospital preparedness system is actually a system where we do what's called hospital bed pools on a regular basis. And Coastal Valley's EMS agency actually has helped us with a really sophisticated way to do that with our hospital partners, not just here in Mendocino County, but regionally and across the state. So this is something that our health officers are doing in partnership with the hospitals to monitor what beds are available as people get sick. So this is certainly something we coordinate at a statewide level in terms of how we hospitalize and treat people depending on their illness and then their level of need. So I just want to be sure, as you hear the hospital's answers to what we have locally, that we're never alone locally as we deal with this determination of how we determine beds and sickness. With any illness, actually, there's a coordination with the EMS system for transporting people to the most appropriate health facility, and that's the partnership we have with the hospital.
Thank you for that. So there are different types of beds, isolation beds or airborne precaution beds, negative pressure. We have several in the emergency room. We have some at each of the hospitals on the inpatient units. What is changing through CDC recommendations is currently airborne. We'll be switching likely to droplet precautions, which would mean that we would isolate in regular rooms.
Can you specify which hospitals you're referencing when you say that, please?
So at Howard, we have, we're a fairly new building and we have negative pressure rooms. We have one in our ICU, we have two on our main floor, we have some in our ER. You know, as Lindsay was talking about with Kaya also, as this is evolving, we also have the capacity to put in what we call HEPA filters. And many of you might have seen those. They kind of scrub the air, clean the air. We have an abundance of those left over from our wildfires. So we have plenty of those. And you might see those even in our waiting room if need be. Did that answer your question?
Yeah.
Okay. And we'll take a final question if there are any final questions, and then I'll ask you, Angela, if she has any final words. Hi, two questions. We'll take two more questions.
I'm Alicia Bales from KZYX Community Radio. I have a question about community spread. We heard, of course, in the community in Washington where people are getting it, and it's been going through the community for 6 weeks without any knowledge. So I'm wondering if that was a situation here where it's asymptomatic or mild symptoms that people have, how would we know if there was the presence of the virus here, and would there be, can you put our minds at ease about that? Would we know, and how would we know?
Thank you for that question. That's an excellent question. First of all, I want to start by reassuring you that 80% of people who get COVID-19, it's mild symptoms, and that children have found not to be affected seriously. What we are doing now with our recommendations is to mitigate the spread by saying that people that are sick, we don't know what they might have. They might have influenza, for example, that they should stay home. So one of the ways we're working to prevent or slow community spread is by having people practice new practices, lifestyle changes so that they prevent the spread. So washing your hands after you've been out in public, when you've been in public, not touching your face, staying 6 feet away if you can from people, maybe not going to that big party that you were thinking of going to, especially if you're over the age of 50 and you might have underlying health conditions. It tends to be more serious in the elderly and people that have multiple medical complications. So we don't know everybody in the community who might be having COVID-19. In fact, there might be people that they thought they just had a little cold and it didn't really bother them much. So we need to mitigate the spread by having our own practices change during this time. And that will slow down the progression so that even if we do get COVID-19, it won't be at a time when so many people around us are getting it. Did I answer your question?
I just wonder, would we be seeing, if it was here, would we be seeing cases in the emergency rooms?
Well, this is a very good question. Lindsay Spencer and was in contact with us yesterday. We said, is there anyone in the hospital right now that has an unexplained respiratory illness in Ukiah that we might be concerned about might have COVID-19? And the answer yesterday was no. Now, I would expect that if we had it circulating in our community, we would be seeing a lot of people in our hospital right now with unexplained respiratory serious illness, and we don't. So I think actually we've been very, as our community, we've been very careful. Everyone we've asked to quarantine happily did it with no complaint. And thankfully none of them got sick, but maybe they were asymptomatic and they might have spread it, you know? So we have a very cooperative community around COVID-19. And also, we're a community where people have self-sufficiency on one hand, but a lot of neighborly good relations. So we reach out to one another, we ask for help, and we're doing the things to protect our community already. So I can't tell you that answer, but my sense is we would be seeing a lot more activity in the hospital right now, like they are in Seattle, if we were having widespread community spread.
So, just the last question. As we all know, this is a community with a lot of older people, and from my understanding that many of the IHSS care providers are independent contractors, and so many of the people who are sort of taking care of the elderly population are not necessarily on staff. And I was wondering if there is any additional training happening for those care providers? I know that that was an issue during our power shutoffs, and sort of what support might be available for them, because they may be on the front lines of identifying potential cases.
Thank you, I appreciate that question. And as the Director of Health and Human Services, we actually reached out through our in-home supportive services network.
As we did actually prior to the power shutoff, to make sure that people who are at home and in need of in-home supportive services and connected with the provider actually have an emergency plan that the provider knows and the client knows. And we actually have already initiated the calls as well in this case to make sure people have their stay-at-home kits versus your go kits you would want to have in a different kind of disaster, right? Or emergency. So we've reached out to several of our vulnerable populations, also in adult protective services and child protective services, in partnership with our behavioral health services community, to really make sure our most vulnerable residents that are connected with county health and social services are aware of the most current information, have a way to get information, and have a plan. And thank you. If there's no other immediate questions at this time, Carmel, Andrew, do you have one more? No? Good? Okay. So Carmel Angela is going to come up and actually conclude the meeting.
So thank you everybody for being here. It seems that we have, certainly Tammy and I in partnership, have been in front of the camera since 2017 when we started having our fires, October 8th of 2017. We're here today with all of our partners, public safety, the hospitals, the schools, and we very much appreciate the work of Dr. Doohan as our public health officer. As Dr. Doohan said, we will be doing press releases from public health on Mondays, and of course we will do press releases throughout the week if we need to, like we did yesterday. You have our contact information up here. We appreciate the partnership with the press as well, because you're out there to give information to the public, information that we would like to present. So thank you very much. Thank you for being here. It's quite possible that in the future we will either do another press conference as things unravel or don't unravel, hopefully they won't, or possibly a community meeting as well. So right now, you have the most current and accurate information from Dr. Doohan. We're in good shape here in Mendocino County. As we said during the fires that we were here with you, the doors were open. Our doors will be open, and we're here to serve you. So thank you very much.